How can pain be visible? Coping therapy makes pain visible so it can be healed. Hello, my name is Dr. Barbara Kleeb, and this is the Polymath Perception Podcast. If you have many deep interests and you have experienced many fields and are able to relate them and find solutions nobody else has found before, you might even find that what you do is simple. Then you are a polymath. And then you find it inspiring to know how Dr. Bettina Kleeb has related all she learned and made it to open her own practice because she got bored in medicine and she wants to help people. If you don't listen, you won't know why Dr. Bettina and I have the same last name, Kleeb, and you won't experience her own unique way of dealing with a problem for people who have been lost through the cracks of medicine and are there with their problem alone. Listen till the end. Then you hear the light Dr. Bettina casts on the social impact on pain and why it is important to act timely for somebody.
It's such a joy meeting polymaths, playing music, writing books, painting pictures, creating, discovering. In dark cellars of IT, polymaths relate and create, discover dimensions that have never been seen, innovate, invent, taking care of people's perspectives. Multiple perspectives is their thing. They're visionaries for a better world. Once the curiosity of a polymath gets sparked, it's the beginning of a deep journey. They have lived many lives within one lifetime, and they share their insights generously. It's so wonderful to be interviewing polymaths. Welcome to the Polymath Perception Podcast. Today I have the pleasure of introducing Bettina Kleeb. Bettina is a Swiss doctor and she's actually a relative. Once I've made a journey on LinkedIn to look for relatives and I found Bettina and we had a conversation, and she is a wonderful Swiss doctor and I found out she's a polymath as well. So, Bettina, can you please tell us what you all did in your life?
Well, you think that I'm like polymath is because I did change my profession every second year. I was more in arts when I was at high school. I was always interested in people and stories. And so I went to medicine. And I started with anesthesia. After quite a while, there was quite an emptiness with women and women in leading position. And so I went up the scale very quick and I become more in the organization. I had to take care of the organization of the operation rooms of the surgery tract, and I lost the contact to my patients. And I thought this is very sad. First, I made management studies for operations theaters, but then I lost connections to the patient. And that's why I went in pain. And I did my education, my training as a pain doctor. And after a while, I thought it's quite boring to tell the patients the same stuff every time or the same story to every patient. So I went to Germany to do a training for mind-body medicine to do group teachings. I wanted to do this group teaching, group pain teaching, group pain education. My hospital in that time didn't want to do that, so I had to change from one big university hospital to another big university hospital in Switzerland, and came into integrative medicine, deeper and deeper. And yes, then I got more interested in psychosomatics. Hypnosis I do for a very long time. I did also as an anesthetist, so that's not new.
And you do this, I don't know the word in English, Schröpfe, do you know the word in English?
Tapping. cupping.
And what else do you do?
I mix up all techniques that I learned in my whole life now in my practice. Primary, I do education to really discuss what the patient thinks he has and what I think he has, and then we find something that we can agree both. And then I do usually the cupping, and I call it the pain landscape. Mapping, because it gives little red spots so you can see the pain. And also when patients come to see me, they often heard, oh, we can't see, you don't have pain, we don't see it in the MRI, your surgery went perfectly, everything is okay, your pain is in the head maybe. And like this, I make it visible for patients with my cupping.
Do the cuppings then look differently when they have pain in one place? Or
Yes.
Oh, really? Can you tell us about this secret,
That's a
please?
wonderful thing. I love it. There are little red spots. This is like Chinese say this is new pain. And then really dark ones, that's old pain. And where these spots are tells you where the pain is. Like where in the muscle, where in the fascia. It makes a map of a landscape. You can see, oh, there is a problem, there's a problem, there's a problem, there we need to go deeper.
And where does pain come from?
That's a huge question. I mean, you can have pain when you broke a leg, but when you are in a war, you will not feel it. You will bring yourself into safety.
Interesting. And when we have a conversation, you told me something interesting about events in life or so, that pain gets sometimes stored in a special part of the body that you can kind of access through conversation.
I don't know if there is much literature evidence, but that's...
Am I interested in literature? I'm talking to you right now. I'm not reading a
and
book.
I see many other therapists can see that too, that when we, not in the first time when I do the landscape mapping, but when I work with my patient, when I work in a muscle, sometimes I can see they start feeling not okay or anxious. And then I ask, what kind of pictures are coming up? What do you see? And then we start working with that. And it's somehow like a way to find stories, pain, old things that hurt the patient. And we can go there and try to give it quite a reframing, another frame, like putting in a other context.
Interesting, because people give you the pain patients they can't deal with anymore because they have given the injections of cortisone or something like this. And then they can come to you, and then you have to use your witchcraft and do other things.
Yes. And what's the goal of a pain treatment? I had students this week, they asked, it's not having not pain, because that's often difficult when you had 20 surgeries, every second articulation is changed and metallic, so it's going to be difficult, but it's gaining the life quality back. And first, there are people, they feel pain like in their early childhood, until 30, 40, ever they don't have an identity without pain. So they first actually need to find, who am I without my pain? Because all the life is defined by pain.
That
so
is
I have to scratch to find who is behind that pain, what would be fun in life, what is the sense, meaning of life, like really digging for the human being behind the pain. Not everyone. I have also a patient that come in with a discal hernia and they're fine after 3 months. So yeah, I have these ones too.
This is so interesting. You're doing like a therapy or a healing?
I like To say it like two of my important teachers in my life, the one say it's like, maybe I don't know the word, isolate, where you put the babies in.
Yes.
Like the isolate, you make a warm space, a safe space, and then you let the patient bring their eggs alive. You don't open the eggs they have. You don't know what it is. Maybe there's crocodiles, maybe there are chickens, whatever. But I'm just holding the space, a really safe space, and I work with them to support them to find their own way. It's not fixing, not healing, it's just creating that space.
Breeding crocodiles. How interesting.
When you do therapy like psychotherapy, you go there, try to find the problem and then fix it.
Yeah.
Or you try to fix it. And it's like a little the opposite. You wait for the problems showing up. And when time is ready, I work through with my patient to that subject. But I don't try to make it quicker. So you need to have that safe space, that good connection before you start opening the eggs.
Who else does stuff you do?
I have one colleague in Zurich. She was working with me for more than 2 years, 2 or 3 years, but she does in a different way. But as we say in hypnosis, we always say, I show you the technique and you do better than me. So she's doing better than me.
Thank you for being so
generous.
But she learned it from you. You're her teacher.
Yes.
Oh, wonderful.
Like to watch the patient in a wider range and searching for the human being behind the pain.
Nice. So sometimes pain is even a good thing. I think pain from the body was actually created to grab attention in a way.
Sure. People who don't have pain, they die in their early teenage years. There are some people, some families in India and Israel, they have a genetic change that they don't feel pain, and it's very difficult to grow up when you don't feel when you have broken your leg or you appendicite or whatever. If you don't feel the pain, you will die. It's like how you handle it when it's not necessary anymore. It's a difference between acute and chronic pain. Acute pain is good because it tells you there is something wrong. Chronic is like a known disease. It gets a disease. Like,
could it be that it kind of calls you to change something so that it goes away as well? What is your...
Usually you need to change things when, yeah, it's always the same. You need to move, you need to eat healthy food, you need to relax, you need to help yourself, stay healthy and go back to health when you got.
Yeah. Interesting.
Well, I had my discal hernia last year. I started more yoga. I did check for my food. I did hypnosis.
Did you do hypnosis on yourself?
Yes, but I had to make audio tapes to myself. Yes.
To get it from outside still.
Yeah.
You have told me that before an operation, you have also a strategy to prepare patients to have less pain after an operation. Can you tell about that?
What stuff did I tell you? Now I don't work in anesthesia anymore, but I have patients going in anesthesia somewhere else. So I record them tapes too. I like to get relaxed before surgery. I had one patient, she had a tape also for during surgery and one for afterwards. So it's just important to feel confident, to feel safe, to trust the team. These are important factors that you will heal better after surgery.
This is very important because we don't know that.
Yeah.
I mean, we do give premedications, or they have stopped doing that, but to take less painkillers, I don't know whether this is a good thing or not. What's your expert opinion on that?
I think you need to relax before you go to surgery. And often painkillers are not strong enough, or the tranquilizers, whatever we use. It's often when you're really anxious, you can take as many Thimistas as you want. And it will not work. And I think it's better to get involved the patient to talk about it. How will it be? What are you afraid of? How can we change that? And then they start preparing themselves like 2 weeks before the surgery. And that gives them the power back. So they know it's my power. I go there to fix my hip or whatever. I want that, and that's why I'm doing it. And that's different when you say, I go to fix my hip because the doctor said I had to. When you go there and say, yes, I go there because I want to ride my bicycle again.
Yeah, that's cool. I always found that explaining an operation in the way that the patient really understands it helps with the adaptation after the operation.
Sure.
When
And
you know what's happening and can kind of have like an inner picture about it.
That's so important. What kind of surgery do you have in mind?
I did gynecological surgery, like hysterectomy. What I always said was that when you remove a uterus in a woman, there won't be a black hole. Some patient once told me that, and I said it to everyone, because if people think they have a hole inside of the body, then all kinds of weird thoughts starts happening. But if I say the intestine goes everywhere and everywhere is always filled with your internal organs, then I found it helped the healing process hugely.
Yeah. And also, like in hysterectomy, is like preparing yourself to a different stage of life, like saying goodbye to your uterus, like, yes, these are the last 2 weeks we spent together. I thank you for having my great kids, or whatever. That's how I see it. I'm glad I had you, but now it's okay.
This is interesting because once I had a wisdom tooth removed, I found out that I needed to tell myself the story what was happening under anesthesia. Do you think this is important for us to get an awareness of what happened when we didn't feel anything?
Not for everybody, but for curious people.
Okay.
I mean, things we don't know, we don't see. We were there, but we don't know anything about. I mean, that's something that can make fear.
Yeah.
Like this losing of control. You go somewhere and you will not be there in awareness, but only your body. I mean, that's scary.
Do you use some artsy things in your setting, in your crocodile breathing?
Yes, I do the pain drawing that people draw their pain. And I do illustrations of what I tell them. And I have patients who don't like when I watch them like this, like doctor, like all the time. Then I do a drawing and they can get the drawing back home. I actually have some patients that collect the drawings we did in the time we worked together. Also, when we do hypnosis, they bring back some ideas, some symbols, and then I draw them as well. So they can get it at home and get something to remember.
Nice. That's wonderful.
I have a lot of fun in my work.
And it's kind of a work that starts in a point that could be really frustrating. And it's not predestined for having fun.
Yeah, most people don't like pain patients. So I don't even like the word pain patients. These are human beings suffering from pain. Then it's different. If you have a pain patient, you think, oh, I have a pain patient again. But then you say, I will meet someone new and I will look with this person what's behind the pain. Then it's a different situation.
It's like a creative exploration of who the person really is and what the pain means for them. So great. I'm loving how you're doing your job.
Thank you.
And you kind of created it.
I did all the stuff that I learned in my life. I also do some injections. I still like it. I think you can change that these days.
What important things did we not discuss yet?
Self-care, how to stay healthy in our profession. One part is the fun I have in my work. The only sad thing about my new job in my own practice is that I'm quite alone, so I don't have people to discuss, but I do meet my friends. This other doctor I know in Zurich, we meet once a month to discuss our patients like we did earlier, and I teach.
Could a hospital invite you when they have a patient with pain that...
Not anymore.
Okay.
That I did that in the hospitals when I
Yeah.
still working in the hospitals, but now I see them afterwards.
Okay. You don't have to go to the ICU and help some pain
Not anymore.
patients.
I don't do that kind anymore. I mean, then they can just give the opioids. That's easy. You don't need to do the whole creative stuff. You have medication, and that's the right point to give medications.
Oh, okay, cool. That's wonderful. I love you and I love what you do and what you invented and how you're helping people. This is wonderful.
I hope you enjoyed this episode with my relative Dr. Kleeb and me talking about pain and all kinds of ways to deal with it in a different way. Before we're going to the social impact on pain, here's some notes. If you are a polymath, one of the challenging things is to find your true purpose. If you want to know more, go to the show notes, find the link, and book a clarity call with me. Book a slot in my Calendly, and I see you for half an hour to explore. Go to the show notes, click the link, and I will see you soon.
And now Bettina tells us of the biggest impact that pain has on the social life of people.
Like pain is not a very well-known disease, and it's not honorated by the system. So like our insurances, they don't pay for pain. So you usually don't get money. So often my patients lost their job because of pain. They lost maybe their wives or husbands. They lose their apartment, like they really spiral down. It's very hard. And difficult when patients don't have money to come to therapy because they can't pay the bus or they don't have a car anymore. They don't fit into the insurance and they are dependent from the social department. That's very difficult to do pain therapy, to find how can we deal with money. About 80% of my patients, maybe it's less, but when you get in this pain, sickness, disease, it's very hard to keep the standard of life. It's very difficult.
It's interesting. And then when you treat them, can they get back up again?
I have patients that go back to work, and I do look for what are the issues? Why is the pain so spreading? Why is that pain so intense? Why can't they get back to work? What's the problem? Sometimes we can find the psychiatry diagnosis very precisely, and then we can do a combination with the pain, and then we can explain it to the insurance, and they can get the money from the insurances. So it's about to find really the exact reason why they can't go back to work. And it's not like pain and a little depression you can't go through, but you can. There's a personality disorder that you're a very perfect person, and this is like a diagnosis. And then you have broken your back, you have a fixed back. So then you cannot work as exactly, precisely, super duper, and then you just can't do the work again because it's not the level you're used to. This kind of interaction helps then to bring the disease in front of the government or whatever who takes care about who gets the money, and then they get the money. So it's again like a detective to watch why people don't go back to work. Most people like work. Nobody wants the money of the public. So it's to find why is not possible. Often they did choose the wrong job, or they had to choose a job because the parents said, or they're from a different country and they can't do their job anymore. Yeah, like this kind of thing, like again, searching for the person and help grow again.
Wonderful. Thank you
Sorry.
so much. I can see what big impact you have had on many lives, and thank you for that.
Thank you for having me.
Super, das ist jetzt spannend gewesen.
Ja, ist noch ein schwieriger auf Englisch, aber schon gleich.